New numbers released today from the Alzheimer's Association are not good. Currently, there are more than 5 million Americans living with Alzheimer's, but in 5 years, that number will skyrocket by 20%. And as we report tonight in Your Health First, here's the story. The 2020 Fact and Figure report is out, showing the death rate for Alzheimer's disease is growing at an alarming rate.
In the last 8 years, the deaths from Alzheimer's disease have increased by 145%. Things like heart disease, cancer, HIV, AIDS, those continue to decrease just based on, we know a lot more about those diseases. The treatments are working, so we see those going down. With Alzheimer's disease, we haven't been able to find that.
In North Dakota, Alzheimer's disease is now the 4th leading cause of death, but nationwide, it's the 6th leading cause. Wagner says we have no clue why the death rate is higher here. For now, only guesses.
Some people speculate it's because, we do have a population maybe a little higher than most states of people who are over the age of 65. However, that's not the only reason. We do see states higher in that percentage of people of that age group who don't have a higher rate as us.
And Wagner says with no known cure and no known cause, it's impossible to stop an epidemic.
There are lots of research studies looking at different medications or different lifestyle changes that could maybe someday, we can prove that it impacts the course of this disease. But for right now, unfortunately, no.
And maybe the biggest concern for the future is preparedness. The Fact and Figure report examines the medical profession's readiness to meet the growing demands for dementia care in America. Doctors surveyed expect a rise in patients, but half say the medical profession is not prepared to meet the demand. Wagner says currently the Alzheimer's Association is preparing medical professionals for the future of Alzheimer's with extra training. But the report also touches on increasing costs of care. So between Medicare, Medicaid, insurance, and out-of-pocket, current cost of caring for patients is $305 billion. But that number is expected to be at $1.1 trillion by the year 2050.